My name is Silpa Dhaneesh. My background is critical care nursing. So I've done critical care nursing for 14 years. And then after the two major strikes of COVID, I started to work as a practice development nurse. And while I was working as a PDN, I took up the course for professional nurse advocacy in 2021. And that course completely changed my ideas about leadership, my perspective about leadership skills. It's more about empowering others or making them to critically analyze the situation and come up with an action plan by their own. And that change has made me to think around how I want to approach my nurses, how I want to support my nurses as a PTN. And I have started doing little projects around newly recruited nurses to make sure that they have been supported well in that transition journey, and their pastoral support is being provided for them, and their well-being is being looked after, they've been valued, and their resilience is protected throughout their transition journeys. After this project, then we had PNAs established in the organization in more than ever, especially after the COVID pandemic. We kind of recognized that, our nurses need a little bit of extra support and, make them feel valued more, and also to improve their resilience. It is necessary to have the service in place. So PhD took it, that is my trust, Princess Alexandra Hospital in Essex. We took it really seriously and decided to bring a lead PNA for the trust, and lead PNA, PMA for the trust, and get every PNA together. So that's how I started working as a lead PNA from August 2022. When I started in 2022 as the lead PNA, one of the questions that has been asked to me is that, what impact you want to see on your staff. And I really thought about the Princess Alexandra Hospital Strategy 2030, which says that, to make this place better for our patients and also for a better working environment for our staff, which is a cultural shift that we are looking at, which has got, which has got negative impact during the COVID pandemic. And I wanted to make sure that our staff feel valued and their resilience got improved through our service. So if I look at the four pillars of the A model of supervision, I can already guarantee that in Princess Alexandra, we have got good quality analysis and education training system in place. I wanted to give a little bit more focus on the restorative clinical supervision and quality improvement projects, because I thought that's the way through to achieve my goal in terms of cultural shift and valuing our staff. And also our staff survey showed that we had a dip after the COVID in terms of staff engagement and staff morale, which where I wanted to focus a little bit more as well. So we have got 21 PNAs, active PNAs at the moment in the trust, and every PNA came together under one umbrella, had one structural framework to work through. And we have also got a feedback loop when every month they come back to me with the themes they have discussed or themes that have come up in the restorative clinical supervision sessions and how staff felt about it. And we do have discussions about how we can come up with an effective action plans to look into these themes that has come up in restorative clinical supervision. So the feedback loop and the structural framework is effectively working in PAH, and that has got a lot of positive impact on the nurses. So some of the projects we have around the well-being and quality improvement projects are well-being week, for example, where all the well-being services in the trust come together under the leadership of Team PNA, and then we select a specific unit to go and talk to the nurses and other staff to make sure that they are aware about the services and they approach us when they actually need. So we have freedom to speak of guardian here for you who do different things in the trust. And if you really looking forward to approach somebody for any of your personal need or for your colleagues, they should know that such service exists. The prime objective about Wellbeing Week is to bring everyone together and have that conversation with our nurses. And if you look at the feedbacks that we have received after the Wellbeing Week or any of the wellbeing activities that we do in the trust, it's so satisfying to see that they felt valued in that project, and they got an opportunity to talk to someone about how they're feeling in their working environment and how we can improve the quality of patient care that we are providing, and also to value our colleagues who is working along with us. I would say we have had a good start and we're kind of establishing our service well in the organization. So our nurses know that PNAs are available when they need a restorative clinical supervision session or when they want to talk about something that is really bothering them in a confidential place, or when they need career advice. They know that there are PNAs whom they can approach, and they also know that there are a lot of well-being projects that's been going on around to make sure that they are being valued in the organization. So we have established our service, and the key ingredient that kind of helped me to make sure that that establishment has been done in the right way is visibility. So we decided in the beginning, I decided that me and my team is going to be really visible around our nurses to make sure that they know about the service. We did a lot of trolley dashes. We came up with key rings with QR code where they can just scan the QR code and get in touch with one of us. So there was a lot of things to make sure that we are visible, a lot of things to make sure that we established in the right way, and a lot of things to make sure that we look at all the four pillars and we kind of connect with it when we come up with any of these projects to make sure that the nurses are being valued. So yes, we have established it, and we are on the process of improving and coming up with new ideas and new project where we can actually focus a little bit more on the quality improvement side in terms of patient care and in terms of nurses resilience. So yes, we are on that process, and my PNAs are so excited about how to do things. Regarding the sustainability, as I know the funding is going to be an issue from next year, as I know there will be new PNAs who is coming up, who is joining the team as new PNAs. If you look at the staffing, we have got about 1,700 nurses in the trust, and we have got 21 PNAs at the moment, and I have got another 5 going for the course this year. So if you look at the ratio, that's almost 1:40. And I think we're doing a great job as far as we keep the visible leadership, as far as we talk about our services, as far as we are there with them, understanding their concerns and issues and offering our service. I do not think sustainability is going to be an issue. Yes, I have heard different things about funding and how the service is going to be in the future, but I'm sure our organization is going to understand the importance of staff morale and engagement and the role PNA is playing in terms of improving those aspects. I would say I'm really fortunate to be in PhD because our senior leadership is really transparent in terms of understanding, okay, this is where we need to focus a little bit more. So I understand they have really looked into the staff survey and valued the opinion and the suggestion came up in the survey to understand that, we need to do something in terms of valuing our staff, in terms of improving our staff morale and engagement. And they have done everything they could do in terms of how we can improve that staff experience and the patient experience in the organization. So I would say I'm really fortunate because I've got such a supporting senior leadership team here, especially my deputy chief nurse and current deputy chief nurse and chief nurse and our board members. So I presented to the board in February about the services that we are doing and how that is kind of supporting our nurses. And they were really passionate about hearing what we are doing in the trust, and they also offered their support in terms of what I need to do in the trust to support our nurses. So it's going fantastic, and that's why I said I'm really fortunate to have such a great senior leadership in the trust. And it's also about you having that passion to take it forward. So I always had this passion, and I always wanted to do whatever I could do in my capacity to support my nurses because I completely understand the pressure they experience. I completely understand the burnout they go through. I also understand the compassion fatigue they feel as leaders. And I also understand the frustration around, when things are not going in the right direction, how frustrated they could get. And it should not affect our patient service. So I had that passion for a very long time in me. And that probably boosted my resilience to face any obstacles that came in my way. So with you have to have the support from your senior leadership, or else you need to put forward that vision and goal to say that, this is exactly what we need in our organization, and I need that support. So you have to have the passion. You need to get the support from your senior leadership, and also you need to understand what your nurses want. For example, when we were doing the Band 6 Away program, we took all the Band 6 away from their working area, and then we had a chat with them. Okay, what do you think is going to make the retention better, make you feel valued? We're going to take your suggestions and work on it. And some of the things that came up in that conversation was having a career clinic to support them with their career development opportunities or career development plans, and having a PNA forum where they can actually walk in for a restorative clinical supervision. And let me tell you, we have taken that suggestion seriously, and we have started our career clinic since November, which is going fantastic. And we also have the opportunity for them to walk in for a restorative clinical supervision via PNA forum. So it's all about, having a common goal or a vision where your senior leadership and you come to an agreement. Yes, this is what we need, and getting that support from them, and also you having that passion to take it forward, and also understanding what exactly your nurses are looking for, or how we can make sure that they feel valued in the organization. So that's something that worked well for me, and I honestly hope for whoever is going to become new lead PNAs or new PNAs, if they have the passion and if they focus on what our nurses need, I'm 100% sure that it is going to be a successful role in their respective organizations.